Right now, we're having an important conversation about breastfeeding. Researchers have shown that it has multiple health benefits for both baby and mom, but certain communities are less likely to do it than others. And this is the case for many Black mothers who face several challenges when it comes to breastfeeding. So joining me right now to talk much more about the issue is Dr. Daileann Hemmings from Maternal Health Equity at Hartford Hospital. You are the director of that program. We've had you here before. Thank you so much for coming back on.
Well, thank you for having me.
This is such an important issue. Talk a little bit more about the major disparity between Black and white moms when it comes to breastfeeding.
There are major disparities. Unfortunately, oftentimes Black mothers aren't given the same support as their white counterparts. And so we see that there is a great disparity between the number of Black non-Hispanic women or individuals that identify as women with breastfeeding. We see that many don't breastfeed up to 6 months, which is what is met as the standard, said to be the standard for how long someone should be able to breastfeed or is encouraged to breastfeed to have really optimum outcomes. People can breastfeed up to a couple years, right? They can breastfeed 6 months, a year, 2 years if they so choose to. And of course, you know, you'll introduce different foods and such, but it's important that people feel supported very much in the beginning phases of this.
So what do we need to do to change that? Is it mostly education?
Part of it is education, right? We do need to have the education, but that happens not only at the time of delivery, like before they actually deliver. When individuals have information before they deliver, they can be a part of the conversation. They can share what their feelings are about it. If there's any hesitation, we can talk through why that is.
And it's talking about creating a plan before, because after you have the baby, there's so much going on. So if you already kind of have a plan about what you're going to do and where you're going to seek the help and the resources, it makes it easier.
It makes it so much easier. Once you know what it is that you want, you can share that information with your support team. Then if a challenge were to occur, because that's part of the piece that we don't talk much about too, is that sometimes breastfeeding can be challenging. And if you don't have the supports in place to help you be successful, that can make someone feel as if they themselves just haven't been able to rise to the challenge, when in fact it may just be support that's needed to get them there.
Right. When you bring in feelings of inadequacy, you're much more likely to just quit. You know what I mean?
Exactly.
I want to have you talk a little bit more about the health benefits, because maybe someone's watching, or a mom or mom-to-be, maybe soon or down the road. They're thinking, well, what's the big deal? Why the hype on breastfeeding? There are so many benefits to breastfeeding, not just for baby, but for mom too.
Right. I mean, you brought up a really great point. We often talk about, how well it helps support the immune system and all of those things for the baby, which is lifelong and extremely beneficial. But for the mother, it helps decreasing chances of some cancers. It helps for the body to get back to where it was before pregnancy. It also helps with bonding. Right now, one of the leading issues around poor patient or maternal outcomes has to do with mental health. Mental health is huge. To have bonding and have the support is really important. We recently had some community events. One of them, we actually had a stroll in West Hartford, and part of it was raising awareness. And the important piece of that was just so that the community better understood that breastfeeding can impact not only a family, but also the community. And that there's health benefits that even an employer can appreciate with having healthier families. So there's a number of benefits that the whole society can benefit from. It's not just about the mom and that baby. It's about the entire family and unit.
Right, the benefits are really far-reaching. And I'm glad that you mentioned mental health, because that's something that continues to need to be addressed. But also there's something that a mom will have a feeling when they are able to provide this, along with the bond, but a sort of a feeling of accomplishment. And that can only happen if they have the support.
Absolutely.
And that's just getting back to the education and the support and having a plan on where you can get everything that you need.
Right.
Because there's so many resources out there.
There are resources. Hartford Hospital, Hartford Healthcare does provide resources, whether it's peer support, going to counselors, there's lactation consultants. There's a number of resources that do exist. It's just for people to know that they exist and to feel comfortable in reaching out and getting them. Someone can receive support from a lactation consultant in the hospital while right shortly after they deliver.
Oh yeah. And for someone who still is just starting their journey, what's the best way?
Well, one of the things is once they know that is what they would would like to do, understanding that we support the decision of all individuals that
Absolutely,
deliver.
yeah.
If they so choose to do that, we're here. We are here to offer that support. They can reach out and speak to their providers when they go to their prenatal visits. So those conversations start to happen early. That's definitely something that can help.
Don't be afraid to ask for help.
Don't be
afraid to talk about it. Don't be afraid to ask your other mom friends.
No.
Yeah.
Advocacy is huge. One of the things we encourage is that patients ask questions, right? And ask questions until they understand what it is that's being said to them.
Yeah.
We understand medical jargon can be challenging, and we are intentional in speaking in a way that we hope the patient will understand. But if there's ever something that you don't, or a patient doesn't understand, continue to ask, follow up, and see how you can be even more a part of the conversation.
Right. The more questions, the more conversation, the better the cause is furthered.
Absolutely.
Doctor, thanks so much. Appreciate you being here once again.
Thank you for having me.